So, a question we get asked often is, what is the difference between dry needling and acupuncture? To keep it super simple, dry needling is a style of needling that falls under the umbrella of acupuncture. To different professionals, it's going to be described in different ways, but essentially it's doing the same thing. To an acupuncturist, dry needling is going to be a style known as orthopedic acupuncture or trigger point acupuncture. And then obviously to other professionals or the general public, dry needling is dry needling. And what that means is it is a specific style of needling for musculoskeletal conditions or musculoskeletal complaints. Typically, you're going to see it utilized for pain, neck pain, shoulder pain, back pain, various types of pain, and it's utilizing needles to target a specific area to hopefully improve the pain and mobility in that area. And it does so by activating either muscle twitch fibers, hitting into connective tissue or adhesions in the body. And the goal is to create improved blood flow and lymphatic flow to the area to either contract and then relax the muscle, or to break up adhesions or areas of blockage within the body. Dry needling is utilized by PTs and chiros, also can be utilized by acupuncturists as well, can be described in different ways. Usually how it's used is going to be different depending on the professional. So PTs and chiros will often incorporate it with their treatments, a chiropractic adjustment, and then needling to release the areas or to kind of support the adjustment. With acupuncturists, a lot of times trigger point or orthopedic style acupuncture can be utilized by itself as a dry needling approach, or can be incorporated into the full body system approach of acupuncture, where you're looking at internal and external systems and really using full body diagnosis to come up with a treatment plan. Dry needling can also be a standalone treatment. We do it in our office as a standalone treatment by both the chiropractors and the acupuncturists to just utilize it for reduced mobility or pain, and can be a longer treatment where we're incorporating things like electric stimulation, where we attach electrodes to the needles to create a continuous contract and relax in the area to really help calm the system or calm the area. Chiropractors sometimes can even utilize it as a very quick treatment, where if an area is not adjusting well or something is just too tight to get any movement, you can throw in a couple of needles to help release the area and see if you can get better mobility with an adjustment post needling as well. So many different ways to utilize dry needling, and both acupuncturists and chiropractors can perform the technique. Everybody has their own kind of spin on it, but we're all coming from the same approach with the same goal.